Some of the most common causes of low back pain and resultant leg pain are degenerative disc disease of the low back, herniated discs, nerve compression, spinal stenosis, and then there's more complex problems like scoliosis. So any of those things can cause back pain and leg symptoms. Some of the more minor problems in the back would be like muscle strains or ligament strains, and those usually will get better just in time. So 90% of people that have back pain, an acute onset of back pain, their symptoms will improve within 4 weeks, just with rest and anti-inflammatories. So usually when people just have an acute episode like that, we just say, take it easy, don't lift heavy things, don't twist, don't bend, take some anti-inflammatories with food because they can cause stomach irritation. And if it persists beyond a couple of weeks, that's when we start to get into the more diagnostic realm of let's get some x-rays and MRI and figure out what the underlying cause is. And then that's when we figure out, okay, this isn't a muscle strain, this is degenerative disc disease or a herniated disc or spinal stenosis. If the problem is degenerative disc disease, the disc, which is a shock absorber in between the bones, if that's the problem, oftentimes people experience pretty significant back pain. And typically anti-inflammatories can help that, or physical therapy, and sometimes epidural steroid injections. So that's really the treatment algorithm for low back pain initially. When we get past the anti-inflammatories, physical therapy, and injections for back problems, that's when we have the discussion. You either live with the symptoms or you have surgery if that's one of your problems, herniated disc, spinal stenosis, or a deformity in the back. And oftentimes we can do a minimally invasive procedure that's less than a 1-inch skin incision, takes an hour, and you go home an hour afterwards. It just depends on what the underlying problem is, of course, but probably more than half of my patients, they're candidates for something like that. To get started today, fill out our form on our website or give us a call and we'd be more than happy to schedule you for an appointment to answer all your questions.